Digital inclusion is a social determinant of health. Efforts to improve digital literacies and internet access are valuable tools to reduce health disparities. The costs of equipping a person to use the internet are substantially lower than treating health conditions, and the benefits are multiple. Digital disparities, understanding the need. 37 million people in the U.S. do not have a computer and internet access needed for video-based telehealth. 1. Most e-health appointments require home broadband, yet the American Community Survey shows that 40% of low-income households lack a broadband subscription to the internet, requiring them to use limited cell plan data or local public Wi-Fi hotspots too. Cell phone options may appear accessible and practical, but costs are high and the user's privacy is limited. Those who do not have access to affordable broadband internet services, digital devices, digital literacies training, and technical support, face numerous challenges: video conferencing with their doctor, checking test results, filling prescriptions, and much more. Many individuals require significant support developing the digital literacies needed to engage in telehealth, with the greatest need among older individuals, racial/ethnic minorities, and low-income communities. Taken in context, the costs of equipping a person to use the internet are substantially lower than treating health conditions, and the benefits are both persistent and significant. Point 2. Super social determinants of health. Digital literacies and internet connectivity have been called the super social determinants of health because they encompass all other social determinants of health, SDOH. Access to information, supports, and services are increasingly, and sometimes exclusively, accessible only online. The social determinants of health shown in Figure 1. Digital literacies and access include the neighborhood and physical environment, economic sustainability, healthcare system, community and social context, food and education. Point 4. Together, these factors impact an individual's ability to access healthcare services, education, housing, transportation, online banking, and sustain relationships with family members and friends. Digital literacies and access impacts all facets of a person's life and affects behavioral and environmental outcomes such as shopping choices, housing, support systems, and health coverage. Recommendations for healthcare systems. Healthcare systems play a crucial role in eliminating health disparities and should screen patients in need of support digital literacy skills. Our recently published paper 3 highlights the hidden aspects of the digital divide and provides 3 recommendations healthcare systems can take to decrease health disparities stemming from a lack of digital access and digital literacies. Adopt a digital inclusion-informed strategy. Systematically assess individual patients' digital literacies, learn about their internet access, and work to address their needs. Partner with community-based organizations, CBOs, with expertise in digital literacies training. When digital literacies and connectivity gaps are assessed systematically and universally, healthcare systems can document overall population-level metrics, examine disparities, implement solutions, and track changes over time. Having data to work from heightens awareness and bolsters efforts to improve digital literacies and reduce disparities. Understanding the nuances of access in the communities they serve can help healthcare systems implement more inclusive strategies. Healthcare systems need to actively partner with community organizations with expertise in digital literacies training. Community-based organizations can provide resources for technical support for those most in need. Libraries not only offer the internet, but also provide a spectrum of training services including basic and digital literacies and skills required for using specific devices and applications for multiple purpose. Some communities have partnered with community health workers and patient navigators to screen and refer patients for support in addressing gaps in basic digital literacies and internet connectivity. 5. 6. Get involved. Immediate action must be taken to address the barriers to accessing healthcare services. Organizations like the National Digital Inclusion Alliance, NDIA, have taken action to support practitioners on the ground who are working directly with the communities and national, local, and state-based organizations to develop solutions that address digital inequities. NDIA amplifies the efforts of organizations that offer digital technology training, subsidized internet, and computers. Visit NDIA's website to access free resources, connect with partners, and network with others who are implementing innovative programs in communities across the country.